Thank you so much. Now, today being a Thursday, we talk about matters health and then also mental health later on. Today in studio, we have Carol Agutu. She's no longer a guest, she's a member. Yeah. Okay. Carol Agutu is the County Health Promotion Officer. Carol, good morning.
Good morning to you.
How are you?
I'm well, thank you.
Good to have you here. Ni this year tumekutana.
Yeah, actually, this is the first time this year.
Good. Happy New Year.
Happy New Year to you guys. I know this is the second month of the year. Anyway, it's the first time we're meeting.
Yes, it's the first time we're meeting.
Miriam ananiangalia kama vivi ndio mtu kusema Happy New Year.
We already set the ground rules.
Yeah, mpaka March.
Ni Happy New Year mpaka March.
Okay. Mpaka March?
Yeah.
Okay. Now we do want to talk about Mpox and it's ongoing.
Yeah.
The first case was confirmed on 31st of July. That is in Kenya.
Yeah.
And in the coastal region, we had a first case on the 29th of July in a 42-year-old man from Taita Taveta.
Yes.
Yes. So since confirmation that we have the first case of Mpox, let's start with the coastal region, Kwanza. How many cases do we have so far?
Okay, we have a total of 8. I'll talk about Mombasa. We have a total of 8.
Okay.
You know, when we talk about coastal region, it means that it covers Kilifi, Kwale, Taita Taveta, Lamu. So let's talk about
Mombasa. Yes, Mombasa.
Yes, so we have 8 cases.
Yeah. And what measures has the government put in place since the first case was diagnosed?
Okay. Yeah. So basically, usually the very first thing to do is just to ensure that the community is aware. Because if they're not aware, then it means that nothing will happen. Yeah. So basically what we've done as a county, we started off immediately when we got an alert of the first case. We started off with the sensitizing the community. And this we've continued with, and we do it through different... we use different strategies just to ensure that the community is well informed.
Yes.
So, for example, let me start off with this current one. Yes. I'm right here, and the main reason why I'm here is just to ensure that we disseminate correct information to the community, so that when they are making any choices or when they are making any decisions, they make an informed choice. Yes. So, apart from creation of awareness using different strategies, radio, chief barazas, we have community dialogues. We even conduct focus group discussions just to get the views of the community about Mpox. And of course, after doing that, it guides us on definitely the key messages that we're supposed to develop to ensure that they pick the right intervention measures. So apart from sensitizing the community, we also ensure that our healthcare workers are top-notch with the information so that they may know exactly what to do. Given that Mpox, fine, it has been there, but of course, anytime it comes on board, we have to ensure that we update them on the latest information, how to conduct themselves. Then our points of entries, of course, screening is ongoing. You know that as a county, we have several countries that borders the county.
Yes.
So we have the points of entry at the port, at the airport, and of course several porous borders. So as a county, what we've ensured is just ensure that our healthcare workers at the entry points are vibrant and of course conduct screening to any person coming within the country, so that we can be able to pick the cases as early as possible.
Yeah.
Yes.
How is the screening done, Carol?
Yeah. The screening is done as per the signs and symptoms. Maybe if you can allow me to mention the signs and symptoms of the disease.
Okay, so before then we go to the signs and symptoms. We're assuming that somebody knows what causes Mpox. Okay. So let's start
right from the top.
Let's start from the top. Yes. What is Mpox and what causes it?
So Mpox disease is a zoonotic disease. I know that's a big term. It's a disease that comes from the animal, then to the human being.
Yes.
That is basically the first transmission. We call it the primary transmission. Then we get now to the secondary transmission, where you find that it's transmitted from human to human.
Yes.
So as I've said, it's caused by a virus known as the Mpox virus, and easily transmitted from one human being to the next. So there are several different ways in which this can happen. So it can happen from contact through an infected individual with one who is not infected. It can happen from mother to child. When I say mother to child, what I mean is that when the mother is delivering and she's already infected, so the child can easily come into contact with the fluids from the macules, or rather, let me call them the blisters, that are one of the symptoms of the disease. Or when the mother is infected, when she's breastfeeding the child, and the child comes into contact with the blisters on the mother's skin, then again the child can easily get infected. One thing we should note is that it's not through the breast milk.
Yes, that's what I needed to ask.
It's through contact. So basically, here is a mother who was delivered or who is breastfeeding. She's infected. So maybe when the child is breastfeeding, the child's skin comes into contact with that of the mother. Alternatively, the mother might be coughing and she has the Mpox disease already. So if the droplets come into contact with the child, again, there's a high chance of the child getting infected. Yes. So the signs and symptoms include headache, fever. There are those who complain of backache. There are those who complain of sore throat. And then, of course, as the disease progresses, you find that the individual gets blisters, or let me call them blisters, for the ease of understanding. Because if I come up with the medical terms, I'll not be doing the general public any good. So there are those, as time goes by and the disease progresses, you find that whoever is infected has some sorts of blisters, which are all over the body, from the scalp to the face to the palms, and even to on the soles of the feet. So it's basically all over the body, including the private parts. Yes.
Sasa, there's somebody who's cleared his throat here. If Salim happens to be infected by Mpox, what are the chances of Gona and I, how do you call it? Coming down with the same
disease.
Yes.
Yeah, definitely high. It depends on how you engage, how you relate with him. So, for instance, I've mentioned about the sore throat.
Yes.
So you'll find that when he coughs, and of course he does not do it in a hygienic way, then it means that the droplets will definitely spread all over the
place,
the surface.
Yeah.
And then again, when he coughs unhygienically, it means that he might even cough in his hands.
Yes.
And you guys use the same door. Yeah. So he coughs, he gets hold of the commonly used surfaces.
Yes.
And of course, when you're going out, you use the same route.
Yeah.
Here you are seated in the same area. He coughs and the droplets are spread all over. Then again, it depends on how close you are to him.
If we hug.
Yes, hugging.
Hey.
So it definitely means that if there's an individual who is infected, so definitely the first thing would be for that particular person to isolate himself.
Okay. Before we go to isolation, you've said a lot of things, Hapa. I want to take you back. Transmitted human to human.
Yes.
Okay. So human to human, how is it transmitted human to human? I would like to know, because when somebody has the blisters and you see the blisters all over the body, if I'm seated in a matatu, right? And Gona is seated next to me and he's got blisters and my skin touches Gona's skin, am I at risk?
Yes, you are. And that's why we are saying the disease is transmitted through contact.
Okay.
Yes. You're at risk.
Number 2, if Gona is my partner, okay, and we are at home, and of course you know what partners do, right? Am I at risk if Gona has Mpox?
Yes, I don't know what partners do, but I'm trying to imagine.
Say it in a medical term. Say it in a medical term.
Ni hiyo?
Yes.
Ngono?
Yes.
That one.
Aya kujamiana.
Yes.
Yes. So definitely what we said is it's not a sexually transmitted infection. But through sexual contact, you can easily get it. As I've said, one of the symptoms is blisters. So it's blisters from the head throughout the body, even in the private parts. So definitely we know what happens.
Yes.
Contact during
Intimacy.
sexual contact,
Yes.
intimacy.
Yeah.
So what if the blisters burst and get into contact with your skin? In the process, there's that bit of kissing.
Yeah.
We've talked of sore throat as one of the signs and as one of the symptoms. So what happens? It means there's an exchange of fluids.
Salivation.
Yes.
It's fluid.
And then
Salivation.
here he is sick with blisters and yeah.
Carol Pole. We don't have normal people in this
Yeah.
exchange
Okay,
of fluid, yes.
let me get back there. You're a couple. He already has the symptoms, and one of them is the blisters. You share the same bed sheets.
Oh,
Yes. So clothings. Those are personal
personal
belongings. So chances of you getting infected is very high.
Okay.
Yes.
Yeah. Still on the transmission, kuna ile ya from animal to
humans.
hiyo bado iko, kwa sababu nafikiria kuna
That's
wakati
the
tulikuwa
primary.
tunaambiwa, kuna ile time tulikuwa tunaambiwa tusile zile nyama za mwitu dili na vitu kama hizo. Hapo nafikiria pengine ungepataja vizuri.
Waona chanzo cha ugonjwa huu ilikuwa ni kutoka hapo kwa mnyama ikaingilia kwa binadamu, na ni kwa sababu vile binadamu huwa anatangamana na wanyama. Unapata kuwa huyu binadamu pia ni anaenda kuhunt.
Yeah.
Sivyo? So anapokuwa yuko kichakani, utajua vile kichaka iko akigwaruzwa na hizo zaitwaje zile miti huko. Yeye mwenyewe amebahatika kushika pengine mnyama katika ile hali ya kutayarisha damu ile ya mnyama, na zile sehemu ambazo alikuwa amegwaruzika inaingia, sivyo? Inapatana. Kama si hivyo, mnyama pengine katika ile hali ya kuwinda imgwaruze, sivyo? So katika ile hali ya kutengeneza ile nyama pia pengine isitengezwe vizuri. Hapo kabisa hiyo ndio shida iliyoko kubwa kabisa. Ndio unapata kuwa tunapata magonjwa kutoka kwa wanyama hadi kwa binadamu.
So hiyo
sasa baada ya hiyo iko
na ni wanyama wote wa pori.
Ni wanyama wa pori wote, wajua kidogo pia siku hizi ni kama sehemu ya binadamu. Binadamu wamekuwa wengi kiasi cha sasa wanaenda kutafuta makazi karibu na vichaka, wanaenda kuchukua sehemu ya wanyama wa pori. So hizi zote ndio shida ambazo tunaona, ndio sababu tunapata kuwa kuna, nitasema ni mlipuko wa maradhi ambazo zinatoka kwa wanyama zikifikia binadamu. Na hata ndio sababu tunaona magonjwa mengi ambayo yanachipuka, na zingine ambazo zilikuwa zimeisha tena zinaanza kurudi tena. So ni shida kama hizo. Lakini la muhimu hapa kwa ugonjwa kama huu wa Mpox ni sasa ile tunaangalia pale kutoka kwa binadamu hadi binadamu mwingine. Sasa hapa ndio tunataka kuangazia sana na kuhakikisha kuwa tunaelezea wananchi kwa jumla, ili waweze kujua ni mikakati gani wanapaswa kuangazia au wanapaswa kufuatilizia, ili tuhakikishe kuwa tunazuia na kudhibiti ugonjwa huu wa Mpox.
Karo,
Yes.
Without mentioning names, sitataja majina ya watu. Some 2 weeks hapo na nusu ama wiki 3 kulikuwa na mkurupuko hii town. Watu hapa kozi zimewauma hii town. Hii town. Watu wameumwa na migongo hii town. Nimekutana na watu kwa maduka ya dawa. Wakinunua dawa. Hiyo mnaita hiyo wadia.
Hiyo self medication.
Yes.
Na wanaenda kwa over the counter wananunua
hiyo over the
kama
counter.
ndio madaktari.
Yes. Ni mtu anasema mimi nasikia mgongo unapasua. nashindwa mgongo unapasua. Unajua ukisema mgongo unapasua mimi akili yangu inaenda lakini mgongo unapasua. Could it be hawa binadamu walipitia hiyo kitu?
Sasa unajua kitu moja, si umesikia nimesema dalili zile ambazo zinaambatana na ugonjwa huu. So ukiwa una jihisi ni kama uko na dalili zile, cha muhimu ni wewe uende kwa hospitali ili waweze kukuangalia na wachukue samples zipelekwe kwa maabara ili tuhakikishe kuwa ni ugonjwa huu wa Mpox. La sivyo hatuwezi kusema ni Mpox. Lazima umesikia tumesema the first confirmed case in Kenya.
Yes.
31st of July.
Yes.
Kumaanisha hatutaki
we're not speculating.
Yes, no speculations. We have to confirm.
Okay.
Yes.
So
we know that you might experience sore throat. You might experience backache. But it does not mean that it's Mpox, because there are several other diseases that also present with the same symptoms. So in order for us to confirm that it's Mpox, samples must be taken and we must get results to confirm the same.
So hapo kwa samples, unajua kuna wakati hapa tulitoa vigongo
for COVID.
Hapa kwa samples mnachukua vipi na ni sampuli gani mnayochukua?
Yes.
Na uwashauri hawa watu wenye wako na hizi vitu wizi sore throat na backaches juu na nini, washauri vizuri because wako wengi.
Yes, ndio unaona chanzo cha sisi kama kitengo cha afya kuhakikisha kuwa tunahamasisha jamii na kuweza kuwaelezea zile dalili ambazo zinaambatana na ugonjwa huu. Ni ili wewe mwenyewe uweze kujua, ukiona ni kama uko na dalili hizo, ni afadhali kuanza mapema kwenda kwa hospitali yoyote iliyo karibu na wewe. Ukifanya hivyo tutaweza kuzuia makali ya ugonjwa. Okay. So the earlier we get a diagnosis, the earlier we can act on the symptoms and prevent the severe consequences of the disease.
Yeah.
So la muhimu kabisa ni wasikizaji, jamii yetu kwa jumla, kuweza kujua ni dalili gani zile ambazo zinaambatana na ugonjwa huu. Ndiposa ukiona dalili kama hizo, ni afadhali uende hospitali mapema ili waweze kudhibitisha kama ni hiyo ugonjwa ama ni ugonjwa gani nyingine uweze kupata matibabu. Kwa sababu kwa mfano kama ni Mpox na wewe unazidi bado kutangamana na watu, inamaanisha kuwa unawatia watu wengi katika hatari ya kupata ugonjwa ule na kuenea kwa community. Ndio huwa unaona kama mtu atakuja na dalili kama hizo na tuone kabisa tudhibitishe kabisa kuwa uko na ugonjwa huo wa Mpox, inabidi kabisa tuweze kufuatilizia ulikuwa umetangamana na kina nani. Ndio tujaribu kupunguza ile kuenea kwa ugonjwa huo mapema. Given that hiyo ugonjwa si ugonjwa mzuri. Sivyo? So tukiweza kufuatilizia ni wale watu ambao walikuwa wamejumuika na hao na tuwaweke pahali pamoja, mbali na wale wengine tayari ambao hawajatangamana na yule ambaye amedhibitishwa, inafanya sasa ugonjwa tunaweza kuidhibiti kwa mapema.
Okay.
Well, we are speaking to Carol Agutu. She's the County Health Promotion Officer, and we're talking about Mpox, the symptoms, what causes it, the symptoms, and also how you can protect yourself. Good morning to you. You're with me, Miriam Angel, Salim Barisa, and Emmanuel Gona. 22 minutes to 9. In studio, we do have Carol Agutu. She's the County Health Promotion Officer, and we just got joined by Hussein Gure. He is the sub-county disease surveillance coordinator, VITA. Hussein, good morning.
Good morning.
How are you?
I'm fine.
Karibu sana.
Pleasure to be here.
Yes.
All
right. We're talking about Mpox, what causes it, what you need to know. All right. As you move around, this is what you need to know. That's why we have Carol and Hussein in studio. Now, Hussein, we've set the basis of what causes Mpox, and we've talked about the symptoms.
Yes.
You know, some of us sasa tunajiuliza maswali. Have we been exposed? You know, but now let us look at prevention. Yes. What should I do? What should I do to protect myself from getting in? I don't know what to say. Getting in contact. Yes.
Just coming down with the disease.
Yes.
Okay. The most important thing is to observe the basic hygiene, like washing hands with soap or using sanitizers, as maybe Caro has explained. Mode of transmission is contact. Contaminated surfaces like the desk on in our front
Yeah.
need to be sanitized. You need to also protect yourself from, for example, sharing clothes, sharing towels, sharing beddings with someone who has maybe suspected of having an Mpox. The other most important thing is to ensure that we sensitize our people, the public, that we have this disease, and the most way of protecting oneself is to ensure that we observe preventive measures, like not coming into contact with someone who is suspected of having the disease. Also, ensuring that we wash our hands with soap and water every now and then, because you don't know who is sitting next to you, or if it's a surface like this, you don't know who has touched before you. So to observe those basic health hygiene regulations, that's the most important thing. And the other thing, again, is to ensure that if you have signs and symptoms, please go to the nearest health facility for a checkup. Yes.
Okay.
Yeah, just to add on that, we talked of one of the symptoms as sore throat. So definitely, if you have a sore throat, somehow you will be doing like Barisa was doing, or coughing. Yes. So if you have such symptoms, use a mask. Then, of course, we talked about the bit of sexual contact.
Yeah.
So it's important at least not to have so many sexual partners. Yes.
And to use protection. Is that an option, no?
Okay, protection definitely for the other sexually transmitted infections is important. But as I said, Mpox is not a sexually transmitted infection, but it's through sexual contact. As I said, the blisters usually are all over the body, including the private parts. So we have to be very careful.
Yeah.
Once there's contact with the fluid within the blisters, then definitely you can easily the transmission occurs. Kissing, transmission occurs. So those are some of the things that we need to really look at and avoid.
Okay.
Yes.
So tuseme umeambukizwa, inachukua muda gani wewe kwanza kujua kwamba, because tunatembea huko, nimeenda pengine nimeingia hapa nimeshika hii surface, na pengine ilikuwa na hivyo virusi, so inachukua muda gani ndio ianze kumanifest sasa itokeze kwamba huyu ako na Mpox?
Kama siku 5 hivi hadi siku 21, 5 to 21 days.
That's the incubation period. Before signs and symptoms appear. Yes.
So within that time.
So kwenye hizo siku 5 mpaka siku 21 ndio sasa itaanza kumanifest. Mimi nikikutana na mtu wakati sijajua kama bado niko na Mpox, kwenye hiyo period ya incubation venye umesema, mtu mwingine nitamwambukiza?
Kwa sababu si ni kati ya siku 5 hadi 21. Hapa hivi maambukizi yanaweza yakatokea.
Naam, lakini pengine kuongezea, as she said, the principal way of actually acquiring this disease is through contact. Through contact. And before the signs, the blisters come out. Hizo blisters ndio zinasababisha kuna majimaji yale ambayo yanatoka kwenye hizo blisters. Ukiashika ndio unaweza pata. Lakini in that period of between 2 or 5 to 21 days, sometimes hazijapasuka zile. So unaweza pata ndio, lakini minimal. As she said, unaweza kuwa na ile sore throat na kadhalika, lakini hujajua. So through kissing na kadhalika, you can still get.
So how does it get treated? So then a patient gets diagnosed with the Mpox. Now, walk us through the treatment process. What begins first? Okay,
a treatment process is once we establish this patient is a suspected case.
Yes.
If he's not on serious state, we just tell him to isolate at home and observe protective measures so that he cannot transmit to other people. But if he needs a hospitalization, then we have an isolation center. We refer that patient to our isolation center at Utange. Yes. So now from there, the patient will be received at the facility. He'll be given an isolation bed. He will be now taken care of us, just like any other patient, but with precautions. Of course, the ones who are actually handling this patient should also be in protective gear. For example, in mask, gloves, the PPEs, general, the hoods, so that because if he coughs, if the patient coughs, he can still transmit. So the patient, the person managing should also be in a protective mode. Okay, the treatment that is given there is management. As she said, it's a viral infection, and in this viral infection, they don't have defined treatments. So it's managing the signs and symptoms, like those blisters, the fever, the headache. Those are the ones that are going to be managed for a period of at least until the blisters dry up, and we now see maybe a new skin coming. Yeah.
So if I isolate at home.
Yes.
What do I need to do? Okay, fine. So we remember during COVID, they test you, find that you've tested positive for COVID.
Yes.
And then either you'd be at the hospital or you left to be at home and alone. It was very lonely. Alone, okay. So in this case where you're saying isolate at home, well, I'm at home. Am I on I'm on medication, right? I'm assuming I'm on medication, yes, at this point. Okay. Now, what do I need to do to protect that person who's around me? Because let's look at this, the family setup. I'm home with my daughter and my nanny. Okay. Do I isolate completely from them? Ama we can have some bit of contact. And at what point do I break out of this isolation? That is, if I'm not isolated at the hospital.
Yes, if you are not isolated at hospital and you are maybe at home, now it needs a lot of discipline, and you need to be frank and tell them that, okay, for a period that I'm going to isolate myself because of I'm infected.
Yes.
You need not to contact me directly, and if you maybe come, then you need to protect yourself. Maybe if you the children, of course, they come and maybe hug you sometimes. You tell them, no, mama, ngoja kwanza. Sanitize after maybe she contacts with you. Let's her sanitize or wash hands. As much as maybe you're at home isolating yourself, we also, as healthcare workers, will be following you to ensure that you are doing the right thing.
Okay.
Yeah.
Carol, yes. Are there is there a vaccine for this?
Okay, yes. Okay. And basically that is also one of the preventive measures. There is a vaccine, but of course not in the country. For the country, not yet.
Okay.
And once it's made available, we'll definitely need to sensitize the community and, of course, talk about it more. But, of course, there are vaccines. For our country, we are waiting. When the time is right, if there's need for a vaccine, they'll definitely introduce one. And, of course, when it comes on board, we'll be able now to break down and say the targeted audience to get the vaccine and such things. And Miriam, I was feeling like I need to say something.
Go ahead.
Yeah. One thing that the community needs to know is that this disease is a disease for like everyone. What I mean by that is that everyone is at risk. And as much as everyone is at risk, maybe there is that part of, there are some people who are more at risk. Yes, and of course, those who are more at risk are the healthcare workers because they come into contact with several different people. So that basically means that they have to be careful when attending to their clients.
Yeah.
And that would call for use of personal protective equipment.
Yeah.
the gloves, aprons, masks when attending to the clients.
Yeah.
Then of course we have the pregnant women who are we know very well when we have when you're pregnant, your immunity tends to go low a bit. So that of course exposes them. Children also, it exposes them to diseases because of the immunity. Then of course we have some professions, and this is because of the nature of their work. So like of course we have those people who travel a lot,
Yes.
in and out of the country. And so what we are calling, or rather what we really want to stress on, is that one thing that we need to know as a community, the disease affects
All.
everyone. And so that means we are all at risk, and we need to really take precautions when engaging.
Okay.
Yeah.
When you spoke about the preventive measures, it reminded me, and I think we had this conversation with you last year, right? And you broke it down and pretty much got me back to what we used to do during COVID.
Yeah.
Wash your hands
With soap.
with soap.
And flowing water.
Yes.
Of course, not in a basin.
Or flowing
Flowing
water.
water. It has to be flowing water always. When we
Wash
talk about
yakienda.
washing hands, it has to be with flowing water.
Yeah.
And not a basin as it used to be those days. Yeah.
Okay, so I want us to say that, like, what do we need to do? What do we need to do to protect ourselves each and every day? Because now that I have it in mind, when I come in the morning, we don't do this. I'm going to have a sanitizer. Okay? When I come in the morning, of course, I'll wash my hands. When I wash my hands with soap, and then have a sanitizer. You've just mentioned the door. We all touch that door. So just being cautious. But I'm imagining that person, because we use the public PSVs, right?
Yeah.
And at times the person you're seated next to, the manner in which to make her, I cannot say, excuse me, I want my own space. So at
course,
times your
definitely.
skin gets in contact with mine, you know. So what do I need to do? Those basic principles that I need to do to protect myself as I go about my daily, my day.
Yes. Now, there's one thing. Those days we used to have these hand washing basins like all over. So we're really calling for that to be reintroduced, and if possible, sustained. They should be placed in strategic points.
In all public places.
Yes, in all public places,
Yeah.
such that once we know very well, like we've talked about the use of matatus.
Yeah.
Several people get hold of that metal
Yes.
on the seat to get in.
Yes.
And during the day, of course, the interaction with the seats and just in the matatus, the public means is enormous. So basically, as an individual, if you walk to your workplace, make it a routine. Just wash your hands with soap and water. If there's no soap and water nearby, then of course we'll go for the option of sanitizing. But the best would be washing hands with soap and water. Apart from that, if you have those symptoms of like coughing, just use a mask. You'll be saving yourself, your family, and the community at large. So those are some of the basics. Then, of course, at workplaces, the commonly used surface. This also goes for the matatu people. I know somehow it is hard, but it's good. It's something that we have to keep on telling them so that we can end up with positive behavior change. The most used surfaces, if they can, let them just wipe. I know they are on transit, but if they can, they should at least have some sanitizer just to sanitize those commonly touched places. You notice someone is coughing, maybe touches the window, does not have a protective equipment.
Yes.
Make a follow-up. Clean.
Yeah.
At our workplaces, let's make it a habit of sanitizing, and disinfecting the commonly used surfaces. If we do that, I'm sure the world would be
A better
a better place to live.
A safe place.
Yeah.
And I tell you, I don't know whether you've noticed this. Have you ever heard of cholera?
Yes.
Have you ever heard of cholera outbreak in Mombasa of late? This was a result of just these simple things that we think do not make a difference.
Yeah.
But just that hand washing, sanitizing makes a big difference.
Hygiene.
Yes, just that hygiene, just basic hygiene.
Yeah. basic hygiene makes a difference.
Yes.
We overlook that.
We overlook that.
So mimi niko na swali hapo kwa ni kutibu dalili mbalimbali. Mmeniambia history incubation 5 to 21. Nao nimepelekwa sasa ama nimeji-isolate ama nime-isolatiwa utange. Nimeanza matibabu. Nakaa huko kwa siku ngapi ndio nipone?
Hadi unaona hizo kama utakuwa umepata hizo blisters hadi zikauke na ile ngozi ya juu ianguke. Hapo ndo tutasema kuwa sasa wewe uko sawa. Wajua hata kuchukuliwa na kupelekwa pale utange ni sasa kama pengine dalili kama hizo zimekutokea kwa sana.
Alright.
But kama utakuwa uko na dalili zile na uelezewe na wewe mwenyewe uwe uko na ile discipline ya kujiisolate na ujue kabisa na dalili hizi ambazo zinaambatana na ugonjwa huu na nimeambiwa niende nijitenge na familia na jamii kwa jumla na ukae tu ngoje siku zako ziishe inakuwa ni sawa. Sasa unajua kuna wengine
inategemea sasa
na kovu
haya makovu mpaka yakauke. Na muda ule ambao uko pale nyumbani tutakuwa tunakufuatilia. Tutakuwa na daktari kuja kukuangalia, tutakuwa na washauri pia kuja kukushauri, maana yake unajua ile hali ya kujitenga saa zingine waweza kuwa na mawazo kama hizo. So kutakuwa na washauri watakuwa wanakutembelea. Daktari atakuwa anakuangalia kila siku na tutakuwa tunakupigia asubuhi kila siku kujua hali yako kwa namna gani.
Na mtakuja tu.
Naam.
Tuweza kufanya through the phone. Kama utakuwa umesema pengine kuna kitu ambao umeona ambayo sio ya kawaida kwa hizo siku zote ambazo umekaa nyumbani, basi kutakuwa haja ya kutembelewa. Ama kuambiwa sasa acha tuje tukuchukue tukupeleke kwa hospitali ili waweze kukufanyia utafiti zaidi. Lakini kama ni unaendelea vizuri, simu iko, kuna wale ambao washauri wa psychologist wa kukuongelesha pia ili usije ukasongwa na mawazo. Kwa sababu wajua pia ni ugonjwa ambao kama uko na inategemea ni jinsi gani ambavyo wale watu ambao wamekuzingira watakuchukua. Wakikuchukua vibaya basi kidogo unyanyapaa utatokea. Na of course utasongwa na mawazo. So hizo zote mikakati ambazo zinawekwa kuhakikisha kuwa huyu mtu ambaye tayari ana zile dalili zinaambatana ama huyu mtu ambaye tayari amepata ugonjwa huu tunahakikisha kuwa anapata ushauri na anaangaliwa vilivyo kulingana na sehemu zote.
All right. Thank you so much, Caroline. We have been speaking to Caroline Agutu, County Health Promotion Officer, and Hussein Gure, Sub-County Disease Surveillance Coordinator, looking at what causes Mpox, but also understanding what you need to do to protect yourself and the person around you. We're going to post this interview on YouTube. So, pale YouTube at Swahili Pot FM, you'll find it. Listen in, get to share. Hussein, kuna kitu wataka kusema?
Sina la ziada.
Yes.
Ni watu tu kuhakikisha kwamba wanajilinda afya yao.
Yes.
Unajua tukisema mtu anaosha mikono na sabuni, you're not only protecting yourself from Mpox only, but several other diseases, including the diarrheal diseases, skin diseases, all other pathogens that cause diseases. So mtu kuobserve hiyo hali ya kimsingi ya afya, the basic hygiene is the most important thing.
Thank you so much. In fact, next week we'll have a conversation on personal hygiene. I think there's something that we need to know. Tunaichukulia hivi, but it's important. Good morning.